Ask you the internal intercostals, I would just ask you the external layer.
Okay.
So if I put a pin in the muscle between two ribs, it has to be external intercostals. So here's a rib, two ribs. So if I wanted to ask you the external intercostal, I would just put a pin between two ribs.
Where's the ribs? Oh, you can feel it. You can't see it.
Yeah, in some places you can see it better. These are the ribs, right?
Mm-hmm. Okay. Got it. So what's the internal intercostal?
I won't ask you that. You'd have to peel back the external layer and make like a flat. You could cross off the internal intercostals.
So now we have the obliques and abdominis.
Okay, so the obliques are the abdominal muscles. Okay, so there are four abdominal muscles. You have one that's like a long strap, like a pair of suspenders almost.
Mm-hmm.
This is the rectus abdominis. It got cut where you open up the abdominal cavity, but it runs straight up the abdomen from the pubis to the sternum.
Okay.
So this is all rectus abdominis.
So we can put it here or here?
I'd probably put it in a few places. Like what I did one year is I put like a pin here, a pin here, a pin here, to show that it was like continuous.
Okay.
And then the abdominal wall has three layers. The outermost layer is called the external oblique. Just notice that the fibers are diagonal. Right? Oblique means slanted, diagonal.
Yeah.
So this is the external oblique. And then remember we try to make like a little window and separate the three layers. So you have the external oblique is the outermost layer.
Mm-hmm.
The middle layer is called the internal oblique. And then the innermost layer where the fibers run straight across is the transversus abdominis. So you have three layers. The outermost layer of the abdominal wall is the external oblique. The middle layer is the internal oblique. And then the innermost layer, closest to the organs, is the transversus abdominis.
So what's this for?
Oh, this is all external oblique, all of this. Right?
And that's rectus abdominis.
And that's rectus abdominis.
So is the latissimus, do you have to like push back the latissimus dorsi to see the external oblique?
No, I mean, it's really different regions. Yeah.
The
and
transversus more in the back.
abdominis is the most internal.
Transversus, yeah.
Okay.
So it goes external is the outer layer, internal oblique is the middle layer, and the innermost layer is the transversus abdominis.
Okay.
So if I just put a pin like on the outermost layer, it's external oblique. If I wanted to ask you the other layers, I would probably peel them. Like I would have to find a cat that has the three layers.
But if you just put it on the outermost layer, then that's confusing because we would think it's rectus abdominis.
No, if I ask the rectus abdominis,